Are you a healthcare professional looking for a trusted concussion resource? Then you've come to the right place. From her New York City studios, welcome to Concussion Corner with your host, Dr. Jessica Schwartz.
Welcome to the Concussion Corner podcast. My name is Dr. Jessica Schwartz, and I'm thrilled to be bringing you our first guest today, Dr. Jeffrey Kutcher. Now, Dr. Kutcher is one of the most consistent, innovative, and truthful voices here in the concussion space, from mainstream media all the way down to research and advocacy. Dr. Kutcher currently serves as the global director of the Sports Neurology Clinic, specializing in the diagnosis and management of sport concussion, post-concussive syndrome, and neurological conditions in athletes across the spectrum. Prior to launching the Sports Neurology Clinic, Dr. Kutcher founded and directed the University of Michigan NeuroSport program, where he established the first fellowship in sports neurology. He is presently the team neurologist for the United States ski and snowboard team and served as the team neurologist for the 2014 U.S. Olympic team in Sochi, Russia. This February, he will be traveling with the U.S. Olympic team again for the 2018 Winter Games in Pyeongchang, South Korea. Dr. Kutcher also serves as the director of the NBA concussion program, has developed the concussion policies, has aided in developing the concussion policies for the NCAA, as well as several college athletic programs and conferences. He is advisor to NFL, NHL, and Major League Soccer Players Association, and he led the effort to create the Sports Neurology section of the American Academy of Neurology and served as the section's first chair. He was also a founding co-director of the annual American Academy of Neurology Sports Concussion Conference. Dr. Kutcher, welcome to Concussion Corner podcast.
Oh, thank you so much, Jess. It's great to be here. Thanks for doing this.
Yeah, I said I wasn't going to read the whole bio, but it was just all too good, so I had to kind of commit. It was like an action potential moment. So.
Well, I appreciate it.
Absolutely. So, kind of consistent with how these podcasts are going to be moving forward is we kind of get to our first podcast together with kind of like your who, how, and why, essentially, how you become such a consistent voice in the world of concussion and kind of what your role is as neurologist and your interdisciplinary models moving forward. And we've got some exciting stuff to cover today, so we're just going to kind of hop into it. So if you can kind of give the listeners here, again, we're speaking to that interdisciplinary listener across the field internationally, from physician to MD, DO, our direct access providers like PAs, our physician assistant, nurse practitioner, our DPTs, our physical therapists, and so on, and all of the other interdisciplinary clinicians, that kind of care for this cohort of patient. Essentially, the point of this podcast is to kind of put the care back in healthcare for our concussion patients and really focus on that interdisciplinary and collaborative model. So I'd love if you could kind of share your who, how, and why you kind of, entreed into the space and share with listeners, your go-to from there.
Sure thing, Jess. I'm happy to do it. So I actually started in this space like most of us did, which is as an athlete. I grew up playing hockey. I've had several concussions from playing the sport. I continue to participate in my adult years. And so it was with that perspective that kind of, I always had in the back of my mind as I was beginning my medical career and starting doing what I was doing. And as a neurologist, I started learning about brain function, the spectrum of brain disease and illness, and really understood how complex the brain is. I actually started my career in the stroke world. I did a stroke fellowship after residency, and inpatient neurology was my sort of first love. I directed the inpatient neurology service at the University of Michigan for about 6 years. Through that, though, I had the opportunity to start working with athletes at the University of Michigan. And this was back in the early 2000s when nobody really cared about concussion on the global scene, for sure. Even on the medical side, people didn't understand it so much. It wasn't really an issue. We didn't learn about it in neurology residency. It wasn't thought of as being a deal. But as I started working with athletes, I learned really quickly that there was a need for critical neurological care in sports medicine, and not just concussion. When I first started volunteering my time, and that's really how it started, was volunteering my time with the University of Michigan Athletic Department. You saw in the training room, you saw migraine headache, you saw epilepsy, sleep apnea, ADHD, and concussions and post-concussion syndrome. I just saw a huge need for sports neurology to be a field, to be something that neurologists could bring their experience from the neurological perspective, marry it with the experience of sports medicine, and really create what our patients needed, which was this collaborative approach. Mm-hmm. So that was, like I said, early 2000s, going to 2004, 2005 was when I started the NeuroSport program at the University of Michigan. Okay. Now, again, you think about when this period of time was back when, like I said, nobody really cared about it. Mm-hmm. And I remember going to the American Academy of Neurology back then and saying, hey, look, this is an issue. And there had been some colleagues, Jim Kelly, for example, a neurologist who's done a lot of work in this space over the decades previous. But there hadn't been an organized effort from the academy standpoint. Mm-hmm. And I got to be frank here, that they didn't really listen. They didn't really see it as a big issue. They were, happy to say, hey, Dr. Kutcher, good luck with that. And so for the first 2 or 3 years, I was trying to establish a sports neurology section of the academy and wasn't getting a lot of help. I wasn't getting any roadblocks, but it wasn't like anybody really cared about it. Indeed. That all changed overnight. And you can imagine when that was. It was in the fall of 2008. Yep. Right? So that's when the New York Times started writing about it, Alan Schwartz in particular. And he started writing about the NFL. And all of a sudden, when the U.S. government started getting involved, now the academy was like, oh, wait a second, this is an issue that everybody is starting to talk about. And it was almost overnight that everything changed. Sports neurology within the academy got a focus to it. I started working with Chris Giza, and he and I started writing the American Academy of Neurology's sort of clinical guidelines on sports concussion with a committee of folks from all over multiple disciplines. And that really began a different journey where I committed myself. My job had then at that point become 100% sports neurology around 2008, and that is what I've done since then. And so it's been a great, wonderful journey, and obviously there's a lot more work to do. But clearly there's a need for us to have these conversations and understand that it takes neurologists who understand sports, it takes physical therapists who understand neurology, it takes really everybody to realize that we have to bring a comprehensive approach to these issues.
Indeed, especially because since we know that, so much of this injury is obviously central, but we also have the peripheral approach as well. We have to also consider the neck, right? We just started talking about the neck in 2012 on an international conversation basis. So it's so important to have folks come in from that interdisciplinary role. So it's awesome to hear you talk about that and to hear your journey. Some of the talking points that you kind of hit on the head, literally and figuratively. I'm a neuro nerd these days, so you'll hear those jokes every so often. And usually I'm the only one laughing at them. But, essentially you were talking about like early 2000s when, quote unquote, no one cared for concussion. And I think that's so important because essentially we're trying to put the care back in healthcare for these concussion patients across the spectrum, acute to chronic. So I think that's such a valuable, piece of information to share with our listeners that essentially you kind of paved the way and created all of this that essentially is present for today in 2018. So, a sincere thank you for that. And I'm sure that wasn't easy. When I was speaking with Brian Hainline, the chief medical officer of the NCAA, and Brian is a wonderful person to be doing that job. He's just the kindest, most articulate, one of the most articulate guys I know. And essentially what most people don't realize is that, again, early 2000s, neurologists, brain physicians, right? You guys are the specialists in brain. We're just entreeing into concussion as like a medical treatment, paradigm shift. And then that 2015 was actually the first formal academic year that there was formal training for TBI concussion as a part of neurology residency. And that was taking place within the behavioral neurology, which transitioned over to sports neurology section of AAN. I was wondering if you can comment on that, just to kind of let other listeners know on, what they should be looking for in a neurologist when they're looking to refer out and work in a collaborative care model.
Well, I think one of the important things to realize is even if concussion itself was never part of a neurological curriculum, everything about concussion was, right? So headache management, sleep issues, attention issues, cognitive issues, all those things are what neurologists are experts in. And so while we didn't bring it together specifically under the concussion diagnosis, these are things that neurologists have always been experts in. I think what's different now is an appreciation of what the injury means, how to diagnose it in the acute setting, how to manage it, how to get people back to play safely, and then how to put it in perspective over the long term. So I think more recently, if you're looking, for in your community, and you're saying, hey, I want a neurologist who understands these issues, you're looking for somebody who probably trained more recently, and I say that not trying to slight anybody, but we have been talking about these issues, over the past 7 to 8 years, whether it's at the national meetings or people, in the literature. So neurologists who go through training now and who are sort of, fresh out of training have been exposed to this a lot more than those from previous. So, but the biggest thing is really just to talk to somebody and get their take on it. And it's pretty easy to figure out if somebody's taking this seriously by the depth of their answer. It doesn't matter if they come up with, the right answer for any one question. It's how do they think about it? A good example would be if a neurologist or a pediatrician or any doctor gives you the advice, well, you've had 2 concussions, the third one, and you shouldn't play anymore. That's somebody who is not respecting the complexity of the human brain. If you have somebody who says, well, 3 concussions and you have a history of depression, that's somebody who's not fully understanding and giving due respect to the complexity of the issue. So I would look for people who give you the best possible information, the most complete answers, because it shows that they have really thought long and hard about these issues and bring them all to the table when they're caring for their patients.
That's tremendous. And I think, historically we've seen, 2 trends in mismanagement would be the kind of this like, oh, you've got 3 concussions. And historically you might know the answer to that, but I don't really know where that number came from. Oh, you have 3 concussions and you need to retire. That's just obviously someone who doesn't understand the complexity of the injury. And then 2, go ahead.
Okay, I think it comes from two things. One, there's a very natural kind of human, societal, psychological thing to the number 3, right? 3 strikes and you're out. There are plenty of even going back to like sort of religious references of 3 things, right? So 3 is kind of a magic number for a lot of things.
Not always 3 wise men, right?
No, right.
Yeah.
For any time humans are describing complex things. But there was some research done back, I want to say, early 2000s that looked at former NFL players and said, hey, in a recall way, sort of, subjective reporting, going back in time, how many concussions have you been diagnosed with? And this one particular paper found that if the person said 3 or more, they had a significant risk of having a diagnosis of depression.
Awesome. Okay.
That was the only time that number was investigated. Now, of course, there's all sorts of ways reasons why you should imply that just based on a retrospective, self-reported data collection. So I think that's where that idea came from.
Oh, that's great information to know. And if you can comment on part 2 of that would be, experientially in my world, what I'm seeing is folks being told a time-based return to anything, return to play, return to activity, return to life. So we're like, okay, take 2 weeks. We kind of have that old McRae-Brolio work out of the NCAA looking at 7 to 10 days. Now, I know that is kind of under embargo and going to come out hopefully later this year. And we know essentially just the gist of that is that data is actually, going to be incorrect, and they're showing new data these days.
Yep.
What are your thought processes or advice to clinicians out there of saying like, hey, this is not a 1 to 2 week. We're not just blindly looking at this. We're actually doing comprehensive, targeted, serial physical examinations on these folks. What's your advice to folks out there that are still using a time-based return to anything? Well,
I think you nailed it when you said you have to have a history and an examination on a serial basis. Manage the patients. Brains don't have a calendar that they respond to in the same way every time. So that's one of the things that I am concerned about in sports medicine dealing with concussions is that it's very formulaic, right? That's the way people want it to be. A symptom checklist replaces a history. A SCAT-5, replaces a neurological evaluation completely. That is not the way you should approach these patients. You need to do a more comprehensive evaluation in a serial basis and manage the patient actively. This is an active process. And I think one of the things, for example, that 7 to 10 day window, and you referenced, I believe you're referencing the NCAA DOD study. One of the things I want to at least put out there to get people to think about, and we can talk about this more perhaps in a different podcast, but anytime you have a clinical outcome that you're studying, like concussion, which is a clinical diagnosis, right? That we don't have a confirmatory objective test. We all know that. It's a clinical diagnosis. When you do large epidemiological studies, such as the DoD CARE project, right? That is a prospective. We're gonna enroll thousands of patients. We're gonna get thousands of concussions over dozens of institutions. You have to be very concerned about the quality and the accuracy of the clinical outcome that's being diagnosed and studied, because you're looking at, well, who's actually diagnosing the concussion? And you say, well, it's confirmed by a physician. Well, what kind of physician? What kind of experience?
Great.
And I think anytime when you think about that, you realize that this is not just a critique for this study. This is just concussion research in general, which is that there's a reason that most of our concussion research produces mixed results or negative results, and it's because we're not careful enough about the clinical outcome going into it. And so you could say 7 to 10 days on average for a concussion, but is that actually accurate management for the injury itself, or is that what sports medicine doctors tend to do in an academic setting because 7 days is when the next football game is, right? Those are the kinds of things you need to think about.
Indeed. Yeah, and it's so wonderful to hear, part of the information that I impart when I public speak or teach. I just had the pleasure to teach the entire rehab staff at Driscoll Children's Hospital in Texas last week, and I let them know, they're like, hey, we have all these types of physicians on staff or in our neighborhoods. And I was like, that's wonderful. You're serving like basically Southern Texas for a pediatric population, which is a large state. It's a big old state, as one of my patients says. And at the end of the day, it's we have to make sure we're not looking at a degree bias. I don't know if I invented that term or whatnot, but again, it's beyond physician, it's beyond physical therapist, it's beyond neuropsychologist, OT, PT, speech, and athletic trainer. You have to have some kind of exposure and training post-professionally, as we've now learned with this injury. I can tell you as a physical therapist and one of our national spokeswomen, to be blunt, my 1500 neuro textbook, there was a one paragraph on MTBI concussion in that. We were not having this conversation. Now, this was early 2000s as well. We weren't even having the conversation, yet you, with your background and kind of us from a rehab background, we're in there in the acute ICUs and on the floors doing rehab with mod and severe TBIs. The goal is to get these folks moving as soon as they're medically stable. So I was wondering if you could comment on, why on earth, we are historically, last century, but if you go on Dr. Google, because that's what people do, folks have essentially been cocooning these patients with MTBI concussion, leading to all sorts of neurological and psychological sequelae, downstream. I was wondering if you can comment on that.
Oh, sure. And you, just to reiterate something you said, I think whatever the specialty we're talking about, in the early 2000s, nobody was actually talking about concussion. So it wasn't just neurologists or physical therapists, but everybody else too. I think I think there's really two reasons. One, it is that natural swinging of the pendulum that we've seen going back from early 2000s to, let's say, 2010, where people went from no concern to everybody's talking about it, and there's advocacy everywhere, and stories on ESPN and HBO and everywhere else. So an incredible shift in awareness almost overnight, right? That's one issue. But then prior to that, we were on the other side where we're saying, hey, a concussion is nothing, walk it off, keep going, keep working, keep working out, keep playing. And so I think those two things combine together to say, okay, well, wait a second, concussion is a real problem, and we've been doing it wrong, and therefore you need to rest until you feel back to yourself or without symptoms. That's where that concept came from. And also, I think, propagated because it's easy, right? You don't have to think about it. It's conservative. So if you're a doctor or a physical therapist or anybody who's worried about the legal side of things, you say, hey, I'm going to just have this person rest until they feel better, so I'm less likely to get them back too soon. And so I think it's been a crutch. And you've seen, we deal with this every single day, patients who are told basically to do nothing until they feel better, and they end up being stuck for weeks and months feeling like crap.
Indeed. And one of the talking points that I discuss, when I speak is essentially, historically in medicine, if we don't know what to do with a patient, we kind of tend down, like we go down two trajectories. We kind of allude that the patient may be malingering and kind of faking it, or we may send them to psych and kind of also allude that they may be quote unquote going crazy. And I think because the nature of this injury is so A, invisible, and B, heterogeneous, we really weren't looking at vestibular systems, ocular motor systems, obviously very neuro heavy. Even the cervical spine, that upper cervical spine with those CO to C3 afferents are so important to our functioning, from migraine to ocular motor function, vestibular function. So I think we really in the last 5 years have exponentially just kind of bursted onto the scene of just fire hose, pieces of information just coming at us as clinicians. And you really have to be dedicated to this world to kind of, soak it all in and then put it into practice. So yeah, I mean, just thank you again for, pushing all this accurate information out for folks, because it's tough, when you're in the trenches and folks may not have access to a sports neurologist like yourself that's so comprehensive in their care. So kudos to you, Jeff.
No, thank you.
Yeah. Indeed. So, we have about 10 minutes here left. I was just wondering, I think for this one, let's talk a little bit about, give them a little high yield information on how to access information. And then part 2 of our podcast, we'll kind of jump into Olympics and the book and, all the fun stuff. But since we have about 10 minutes left, let's talk about, the founding roles of the American Academy of Neurology Sports Concussion Conference and kind of all those high yield pieces of information that most of them are free open access to clinicians out there, and even coaches and parents. So I was wondering if you could comment on kind of how that formed and what its role is today.
Sure thing, Jess. So the American Academy of Neurology Sports Concussion Conference was born out of the idea that we needed an academic meeting that brought together all walks of life on the academic side, on the medical side, to talk about current research, new findings, new ways of handling the diagnosis and management of the injury, to really dedicate several days. The conference has been 3 days typically, really to getting everybody together and talking about what we're doing and moving forward. From that foundation, it's really been one of the most rewarding aspects of my career so far to be involved with that and to help set that up, because it's amazing when you get neurologists and neuropsychologists and physical therapists and primary care doctors and ER doctors and sports medicine people all together in a room and just start sharing, really. That's really so powerful. And we're not there to make a consensus statement. We're not there to have any kind of agenda about, serving a sport or serving a league, or which I think is a big problem in a lot of what we do. We're there to serve science and our patients. And what that's produced, I think, is really a higher level of conversation, critical thought, and it's really moved the whole field forward, I think, in a really substantial way. Again, I think once we had the idea to have the conference, I think being who the neurologists, being who they are, being the brain experts, the academy, really kind of serving that. What I really wanted to emphasize with them, though, was, look, we can't have just a neurologist conference. This can't be the, only for neurologists kind of thing. It has to be for everybody. And we've been trying to be very inclusive, getting athletic trainers there as well to really help our patients in the end.
Indeed. And, the value of the athletic trainer, especially as physical therapists, I know we have some, historical beef, but, these athletic trainers are seeing these athletes day in and day out, and they have that rapport built with them. So it's like therapeutic alliance 101, you don't even have to be that great. Historically the data says, if you've got therapeutic alliance with your patients in front of you or your clients, you're already 10 steps ahead of most healthcare professionals these days. So I'm all for building up the ATC.
Oh yeah, I'll tell you, when I first started getting into this world, I had a good friend and colleague, Tony Alessi, sports neurologist in Connecticut, who gave me the advice. He said, look, the athletic trainers are the most important collaborators you'll have because they see the athletes every day. You know, they have access, but they also know the patients the best. They are trained on triaging, at the time during the events directly, and I think that's been really good advice.
Yeah, absolutely. And I know Tony, he's a good guy. He always, I think he came to the American Headache Society conference with his daughters last year, actually. So he's
a little shout out. One of his daughters, Stephanie, will be one of our fellows next year, coming up in July.
No big deal, not at all. Yeah. I know. But between the Galettas and the Alessis in the world, I think we're in future good hands, right?
Yeah, I think so.
So I think we've got a little bit of time. I'd love to highlight your book just a bit for the listeners, because essentially I'll put in like some show notes for AAN. I'll put in some show notes for our listeners on your Sports Neurology Clinic, how to reach out to you, refer, and so on and so forth. But I'd love to highlight the book just a bit, and we'll kind of continuously talk about this in our future conversations. But essentially exactly to build on your AAN Sports Concussion Conference work, essentially is that inclusive model, right? You essentially wrote this book. It's written in real world language for a common audience, but it has this high level discussion, mixing in neurology-based discussion with neurology based on science and medical knowledge. So just wondering if you can kind of, let the listener in to like, hey, this is why I decided to write a book, and kind of how that came about.
Oh, sure. So it was a very natural extension of conversations that I have every day in clinic. So, it's the re-education of parents and patients about what concussion is, what it isn't, what the real risks are, what the long-term risks are. There was a lot of misinformation, a lot of, I would say overemphasis on the wrong things. People weren't, again, looking at the big picture. So clinic visits with us tend to be long and involved, and we do a lot of education, have a lot of discussions. And it struck me one day.
How long are your clinic visits, just so people can understand the kind of work that this takes?
Sure. Well, a new patient visit will start at an hour and will oftentimes go maybe even up to 3 hours. Mm-hmm. And we take that very seriously. It's not a good financial model. No. So insurance companies will pay you the same regardless, but we're very passionate about what we do. We want to make a difference for the long term. So that education is absolutely critical to this mission. And so it did strike me that putting those conversations into a book form would help get that message out to the people who don't come to clinic. And that's really the essence of the book. And I was fortunate enough to co-author Joanne Gerstner, who is a sports journalist who took a year off from her career in journalism to basically shadow me wherever I was going, whether it's in clinic, speaking at meetings and committees, doing research. And she brought a lot of valuable information to the team as well. And between her and I, we realized that the book was something that we had the opportunity to get out there and really help people on a larger level.
Oh, that's tremendous. And for the listeners, the book is called Back in the Game: Why Concussion Doesn't Have to End Your Athletic Career. And it's written by both Dr. Jeffrey Kutcher and Joanne Gerstner, obviously a professional journalist with a background in reporting on sports science. So, I mean, it's just a double whammy, a 2-for-1 right there. And it just really brings a unique perspective for folks out there. And you don't have to be, in Jeff's backyard. You can be anywhere in the world and read this book and get some high yield, great information. So I really do encourage our listeners to get that either on Kindle or paperback or hardcover. It's out there for you, and I'll put the Amazon link in our show notes. All right, Jeff. So, I think what we'll do is we'll kind of lock up shop here for this podcast episode, and we'll kind of leave the listeners kind of on the edge of their seat. I do want to really get into the nitty gritty of, talking traveling physician, obviously for the Olympics and everything that you do. I think it's just exciting to hear and learn about. And so potentially our listeners can also pick up on some clinical pearls. And then we'll kind of get into some more clinical discussions as well for part 2. In the meantime, what's the best way for folks to kind of reach out to you and say howdy?
Well, the first thing you can do is visit us online, of course, at the sportsneurologyclinic.com. There you have access to phone numbers to call us, emails to get a hold of us that way too. I'm on Twitter at Jeff Kutcher, MD. You can direct message me through that avenue. And I look forward to helping people out any way I can.
Awesome. And thank you so much for being here with us today. And again, thanks so much. And I'll look forward to part 2 and kind of leave our listeners on the edge.
All right. You're welcome, Jess. Happy to do it.
Thanks, Jeff. I'll talk to you soon.
Okay. Bye-bye.
Thank you for listening to the Concussion Corner, hosted by Dr. Jessica Schwartz. The information in this podcast is for entertainment purposes only and not to be used as personal medical advice. Don't forget to follow us on social media on Facebook, Instagram, Twitter, and YouTube at Concussion Corner.